Dr. Louanne Friend joining us on Health Matters today. Thanks for your time and for joining us today.
Good morning. I'm happy to be with you.
We're talking about a hot topic today, and that's the flu. The season, I guess, is near its end now, but this has been a real challenge. We've heard a lot of things about the effectiveness of the shot. Have you found this season to be unusually challenging?
Yes, it's been a very active flu season. I think in the state of Alabama, they've got 3 times the activity that they did last year.
Unfortunately, not enough people are getting the flu shot. I get the flu shot. I'll bet you get the flu shot. But I think I've heard 45% of the population gets the shot. For the good of everyone, more people need to get the shot. How can you doctors and us in the media do a better job of educating people and getting them to get involved?
Well, I think doing segments like this, I hope, will help. We try very hard to explain to people. Unfortunately, there was some bad science published several years ago about the hazards of all vaccinations in a very good journal. And I think sometimes it just takes time to kind of break those stereotypes.
There's so much misinformation about the flu shot itself. We can start with, oh, I don't like getting shots. Well, that's fine, but it's not a pain. No shot's painful much anymore because they've improved the needles so much and the expertise of giving them. But also people still say, I got the flu shot and I got the flu. I think the shot caused the flu. Dispel that. It's just not reasonable.
It's not reasonable. It is possible to have already been infected and then you get your vaccination and just, by coincidence, you get the flu, but it's not caused by the vaccination.
Before we began, I said, I wish you would just give me a shot that takes care of every strain known to man. That's something a layman might say, but medically, that's just not possible.
It's not possible. We try to find a vaccination to cover 3 to 4 strains of the flu, and data is collected from all over the world to try to identify what we're seeing, what virus we anticipate. But it's not a perfect science, but nevertheless, you still need to get your shot, even right now.
Even if you got the shot and got a strain of the flu, maybe that wasn't covered by the vaccine, might the vaccine help alleviate or lessen some of the impact of that disease?
That's absolutely correct. It will lengthen the time that you're sick, it will lengthen the severity of it, and it will also keep you out of the hospital.
I get the shot about the time everyone says, oh, it's time to get your flu shot, or my doctor says it's available. I get it about then. Does it matter when you get it? Do you recommend right at the front end of the flu season? What's your thoughts on that?
Well, personally, I didn't quite get it on time at the very beginning, but I got it within the window that was recommended, and they're still recommending. Even we're not sure that we've faced the very worst of the season, so it's still recommended to please go get your flu vaccine.
We hear people, I've had the flu. It's been years. I've never had the flu since I've gotten the vaccine. For getting the vaccine and a little bit of luck, I imagine, or good hand washing. But I hear people talk about the symptoms, how bad it was, and they didn't think they'd ever get better. But this season, we're hearing more about actual deaths, and not just people predisposed to respiratory problems. There's young people, as recently as this week, passing away in Alabama. This is a serious, serious subject.
It is a serious subject, and I think there's been 1 confirmed pediatric death in the state and about 53 adults. Unfortunately, from what I've read, nationwide, the children that have succumbed to the flu were not vaccinated. But children get sick in a different way. They have a lot of nausea, diarrhea, so they often get dehydrated and probably should go into the hospital for fluid resuscitation. But it has been a very bad flu season, and what happens with the flu is that you can get secondary infections, predominantly like pneumonia. And so I think some of the people that we're hearing about that died probably had either chronic underlying disease, so they were more at risk of dying from the flu, but they also probably developed a secondary infection and then developed what we know as sepsis, where the body just has a widespread inflammatory response. Once that happens, there's about a 50% mortality rate.
So you've made it clear the flu is bad, but it's other issues it causes or exacerbates that get you in trouble and can cause your death.
That's correct.
I'm a pretty good hand washer, but I've almost wore my hands out this flu season because everywhere I turn, every doctor or druggist says, wash your hands, be sure and wash your hands. And I'm doing that. And that's still solid advice. It's hard to beat good soap and water.
That is the best advice, good hand washing. And if you're sick, stay home. And unfortunately, a lot of times we're very busy. We don't necessarily want to miss work. We certainly don't want our children to miss school. But if you are sick, please stay home. You can even call doctors' offices and they'll have protocols where you don't have to come in to get Tamiflu or some of the other antiviral medications that might help.
Tamiflu is very helpful. It's been proven to be pretty successful in alleviating symptoms. That's the main reason for it?
That's correct. And if you get it early, within 24 hours, it usually lengthens the duration and decreases the symptoms. But good rest, common sense. Get your rest, exercise, eat well, all of the things that we know we should do, and absolutely good hand washing and coughing into your sleeve, because the flu is spread by droplets that are produced when you cough or sneeze.
And if you cough into your hand, you're just asking to transmit it to someone else. If you cough into the air, can you pick up those droplets in the airborne?
Absolutely.
So, wow, it's just so many
And
ways.
that's why it spreads so quickly, especially in kids, because they're together in schools and daycares all
So
day
cough or
long.
sneeze into here, wash your hands every time you're near a sink. Just keep them good and clean.
Or the antiseptic hand wash also is effective.
I'll make this my last question. Are you somewhat optimistic that going forward, as we vaccinate for certain strains, the ones they think are going to be most dominant during a flu season, is there a learning curve for that, where those that do that research and those studies will get better at it, or they only have so much to work with each season?
Well, no, I think that, science is always getting better. And I hope that we will have more efficacious vaccines going forward, but that's not something that we can really predict. And unfortunately, you have other flus that come from traveling internationally, being exposed to birds and I believe pigs. So those are your kind of atypical flus that people can get. But yes, I'm confident that the flu vaccines that are made available will help us.
Very good. I've noticed some people, instead of shaking hands, they're doing fist bumps.
Right.
Is that smart?
I don't know. I don't know. If you're sick, I don't really want.
You don't even want a fist bump. Well, we're not going to shake hands or hug. We'll just thank you for your time today and your expertise. This was an informative segment, and we thank you for your time.
Thank you very much.